Welcome to Canada's podcast.
Hi, this is Celine Williams hosting from Ontario for Canada's podcast. My guests today are Timothy Coe, CEO of Entheon Biomedical, and John Lem, CEO of Lobo Genetics. Thank you both for joining me today.
It's a pleasure to be here.
Absolutely. I am really curious. I love when I have two guests, just for the record, because it's always a fun flow of a conversation. But I'm really curious to hear from each of you kind of your journey to get to where you are today and what you're doing in the world. And then as part of that, you can tell us a little bit about what you are doing in the world and explain a little bit about what you're up to.
Yeah, totally. It's hard for me to describe what Entheon does without getting into my personal story. For me, Entheon is sort of a reaction to a sort of a meta condition that exists within the world as it pertains to addiction medicine. I had a brother that was a multi-decades-long drug user. Over the course of about 20 years, he suffered from a variety of drug addictions, principally opiates and amphetamines, as well as other sort of stimulants. Over the course of those 2 decades, we really did try to get him all of the help that was medically available to him, spending hundreds of thousands of dollars, thousands of hours in psychiatrist offices. About 3 years ago, I became acutely responsible for his care as my parents just didn't know what to do anymore. And over the course of I guess that was 4 years ago, about the 2 years that I was his primary sort of care contact, it was a bit of a case study in terms of the limitations of the conventional drug treatment models that exist. He was in about 5 or 6 different drug treatment centers.
Wow.
Methadone, Suboxone, all variety of other mental health medications like antipsychotics, anxiolytics, antidepressants, and none of it sort of in totality combined or in separate pieces combined with mental health practitioners. None of it had the effect that was desired, and rather just treated the symptomology of his condition and made it so that he didn't really have access to that inner, I guess, narrative, that inner wisdom that's so necessary in unlocking some of these answers about, hey, why do you tick the way that you tick? And I guess over the course of that period, his state worsened, and we actually lost him to an overdose in March of 2019. And so that was really difficult. And, in reaction to that, there was just this sense that there had to be something better, better than what was available. And I think the huge death count of sort of drug-related deaths experienced in Canada over the course of the pandemic is indicative of the reality that there aren't really good options for people that are suffering from substance use disorder. And so there was all this rumbling about psychedelics. And from a personal perspective, I'd use them to help improve my life. And so, we made it our mission to really seek out the knowledge keepers in the psychedelic space and say, hey, the transformational power of psychedelics, everyone's talking about it. Is there an application for people that are suffering from addiction issues? And the answer was very quickly and resoundingly yes. The transformational potential of psychedelics, as it applies to people that are suffering from, end-of-life anxiety or from depression issues, there's a internal kernel of significance, of profound internal meaning that is, essentially operative in people that suffer from addiction-related issues. And so pretty quickly, we went from confirmation of, hey, can psychedelics help people to, hey, what is the best way to administer this and what's the best molecule? And so ultimately, we arrived at DMT for the purpose of treating addiction. And that's what Entheon's core focus is research and developing ways to administer DMT, dimethyltryptamine, for the purpose of treating addiction. But then going beyond that, I think we'll get into it with John, going beyond just this notion of psychedelics as this panacea to treat any and all conditions, but actually really diving into, what makes an individual so unique so as to, not just blanket them with any substance, but really dive into the personalization components, encapsulating things like genetics and sort of neuroimaging to really develop a personalized treatment program to ensure that we're capitalizing on these, these brave people that are taking this opportunity of willingness to seek treatment and to get well, really wanting to capitalize on that opportune moment and deliver a personalized form of care that is most likely suited to treat them effectively. So yeah, that's where I come from.
So thank you for sharing all of that. I am sorry to hear about your brother, obviously. And I think I love the personalized lens that you've taken inside of this and that your company's really focused on. Because I think that, and John, I definitely want to hear your story, but I just want to acknowledge, I think that that the more we can make things personal, so we are having we get the best results, they're as effective as possible. And I know it's super challenging inside of anything to do with healthcare, but there's so much value in taking that lens of how do we make this work for the person so they have the best experience and the best outcome, as opposed to what I feel like happens a lot of time, especially if you think about psychedelics in the not medical field, where it's kind of a crapshoot what someone's reaction is going to be. You're kind of hoping for the best, and there just isn't that ability to take the personalized lens. So I just want to acknowledge, I think that's really cool. John, I'd love to hear your story.
So not as personal as Tim, but definitely has a personalization aspect. Global was originally founded from a conversation with another entrepreneur that just so happened to be a senior executive at Aurora Cannabis. So this was back in 2018. And one of their components of their business was running actually medical clinics in Canada. And they were consistently noticing that around 10 to 20% of their patients were having stronger side effects than like 80% of their patient base. And so we sat down and we had a discussion based on my background in genetics. Is there a genetic reason why this keeps happening, why they keep seeing this 10 to 20% of the population that when they dose either THC or CBD for pain or for sleep or for other conditions, why they have more side effects? And so that really became Lobo Genetics, where right around that time, cannabis was not recreationally legal yet in Canada. That happened a year later in 2019. And Lobo was originally established to create that personalized aspect to cannabis therapy. And cannabis, similar to psychedelics, it shifted where it was seen as something that was very recreational, with no therapeutic purpose. And it shifted into it's both recreational and there's a therapeutic aspect. And so that was really how Lobo got started. And the transition into the partnership with Entheon was we had built this technology platform for personalization. And we connected with Entheon, and they were embarking on their journey to personalize psychedelic treatment. And Tim's vision of creating personalization through genetics and technology really brought both of us together.
So completely based on the whatever that anti-drug campaign I remember as a kid in like the 80s that was huge, right? Like it demonized everything, and we've taken so long to really see the potential and the value. So I just want to acknowledge, I love that you have come together in this way that's saying like, hey, let's really look at what's possible inside of this world and let's remove the stigma from it. And to me, that's I really appreciate this conversation for that reason. I think it's important to have these conversations out in the open. And especially because like there is real science behind all of this.
I think that's the critical point, that if we start from a perspective of science and benefit to people, you can kind of isolate the history of the past and focus on what good it can do. Because any drug can be abused, right? Alcohol can be abused, and
of course,
like 90% of the population in North America has a drink once a year, like consumes alcohol. So when you look at prohibition that happened in the 1920s, and then alcohol is completely normal now, right? And so I think we can't understand the mistakes we're making currently unless we look to the past and understand the history of psychedelics and why it was made illegal, and the potential benefits now, 20, 30 years later.
Yeah.
Totally. I think in the absence of, I'm just so pleased that we're returning to the investigation, science-led investigation of psychedelics, because I think one of the things that we've seen in the absence of psychedelics is as of now, the conventional approaches to treating things like mental health and addiction-related issues that are so heavily reliant on pharmacological interventions, various drug therapies. And in spite of this huge optionality in terms of the drug choices that exist, we are still seeing this consistent uptick in, psychiatric disorders as well as addiction. And so, to echo what John said, I think it's high time that we're reinvestigating this, but, taking that data-driven, that science-first approach to really validate. And I do think it is super important to get into the weeds of the science, to really present the data, because ultimately we are trying to change lives in a very medically necessary kind of way. And so I know we talked about bureaucracy, sort of previous to this call as being this burdensome and terrible thing sometimes, but that bureaucracy does exist for the express intent of ensuring that the drugs that we're creating are safe and effective. And so I do think we exist in this really opportune moment where we have the ability to create this amazing data to validate some of the assumptions that we have. And so really excited to be sort of on that leading edge of scientific discovery.
So can you tell me a little bit about what it looks like right now for the work that you're doing? Because and I'm going to fully acknowledge, this might be completely ignorant. I'll fully acknowledge, no problem sounding ignorant on the podcast and acknowledging that this might be an ignorant question. But, as far as I know, psychedelics are not legal, whether it's in a medical, whether they're being prescribed, which I don't think they can be because they're not legal. As far as I know, that's my understanding. They are not legal. So how does this work? What is it that what does this look like for you? What does the future of this potentially look like? I'm really curious because to me, I'm like, I don't know. I just don't know how it would work.
Totally. Yeah, no, that's it. And a lot has happened and a lot is happening since a few years ago. One of the things that we do, the wind in our sails, is, I think there is a perspective change in terms of these things that were once villainized and just are vilified and said, oh, no therapeutic value, just purely for the purposes of, potential abuse and addictive, looking at through the lens of addictive potential. Some of the work that's been done recently over the course of the last decade or so has seen a revision of some of those perspectives there. Recently, we've had the full approval of a ketamine variant called esketamine that has gone through full suite of approvals and is now ready for prescription. That is available for prescription for the purpose of treating depression, and as well as some off-label usage for other mental health indications. And we are seeing the progression of some previously, similarly vilified substances such as MDMA and psilocybin. They're moving their way through the regulatory process in various stages in phase 2 and phase 3. And so, that bureaucracy that we referred to before, it exists, and it is sometimes an arduous, cost-intensive hindrance. But from the perspective of regulators, there is still some seemingly unbiased framework to submit drugs into. And so, we are leveraging this classical drug discovery sort of regulatory pathway that is maybe not so informed by some of the historical biases of the past. At least we're seeing a shift in perception that is indicating that there's a really increased willingness to investigate these things or to evaluate these things. And that being the case, what that process is reliant on is academic rigor, scientific rigor, and the presence of very clean and understandable data. So companies like ours, as well as a variety of other companies, are leveraging that system to enter into clinical trials, these various psychedelic compounds for the purpose of treating a variety of mental health indications. And so that goes through the normal course of safety and efficacy trials. And the work that we're doing, we have a clinical trial plan for Q4 of 2021 extending into 2022 that is looking at that safety component of dimethyltryptamine. And then, the natural course of business will take us to subsequent trials.
So, and John, this might be a question for you, I'm not sure, but I'm curious, when we talk about, you mentioned the like personalizing, let's call it, of the experience, and there's a genetic component inside of this. So what is that? I mean, I'm going to assume, and I might be wrong, again, totally fine if it's an ignorant question, I'm going to assume you're not saying, let me take your genetic Celine and I'm going to create a completely customized drug for you. I assume that's not it. If it is, very cool. But in light of that probably being unlikely because it would be expensive and time consuming, what does it actually mean to have this genetic component and to have it be more personalized?
So that's a great question. So I think it really is in two buckets. One is a short-term impact, and then one is a long-term impact. So the short-term impact is your sensitivity or metabolism to the drug. So this is a well-established area of medicine for personalization where, depending on your genetic profile, you can metabolize a drug differently than the person next to you. And you could have a slightly different reaction or potentially a stronger reaction depending on your genetic makeup. And then the second part of it, which is the long-term aspect, is there parts of your genetic makeup that expose you to potential long-term risks for taking these sorts of psychedelic substances, because they do affect the mind. So if you think about the discovery and treatment of schizophrenia, of psychosis, there is an underlying genetic basis for that certain percentages of the population, it's not a very large percentage, but it is statistically significant in the 1 to 5%, they are more predisposed to psychosis or schizophrenia. And then in terms of the metabolic side or the sensitivity side, again, that's not a huge percentage of the population, but it is still significant. It can be like 5 to 10% of the population. So 1 out of every 10 or 1 out of every 20 people that you end up dosing with certain drugs, they can have a more strong reaction to it. That as the clinical trial where we're starting, or eventually, hopefully, clinicians prescribe it, that empowers both the individual and the clinician with that information to make better decisions.
Got it. Really interesting. So I don't know if this is is the next step beyond, so you've clinical trials coming up. That seems like it's kind of the next step of this. And are they specifically focused on, well, I guess here's the question. Is this really about what you're doing? I'm sure there's lots of things out in the world. It's not, I know this is a big space, and I am aware that there are lots of people exploring these things in different ways. Is your focus really on, would the next step be really focusing on various like addictions specifically? Is it more about treatment of other mental health disorders that people might have? Is it a combination? How would that work? Because it feels like, external lens, I'm not in your world, but it feels like it could be a lot to take on, this world of like mental health plus psychedelics plus, like, it feels like, oh, this is big.
No, it's a really great question, and it is, I think, an accurate analysis of the psychedelic space. There are a lot of companies proposing to treat a huge spectrum of psychiatric disorders. Entheon's focus is primarily on addiction-related issues. So our first, sorry, I have a dog running around here.
This is podcasting real life.
This is pandemic podcasting, right? We have dogs and cones running around all over the place. Entheon's focus is on addiction. Our first trial is a safety trial, but there is also inclusion for healthy smokers to see if there's a quit smoking signal included within that group. And then subsequently, as it relates to DMT and DMT-related molecules, we're going to be exploring efficacy of treating a variety of these. Each addiction population is unique. The opiate addiction population has unique exclusion criteria, separate than an alcoholism population. So on the DMT drug discovery side, we are going to be exploring a multitude of efficacy trials. And that's one component of the business. The other component, as John and I have been speaking about, is this notion of personalization.
Right.
For us, personalization will certainly help inform how DMT is administered, but included within the genetics test that's commercially available now is inclusion for not just serotonergic psychedelics, to which DMT and psilocybin and things like that exist. There is also inclusion for ketamine. And so some of the investigational work that we're doing is to sort of validate the utility of these different metabolism biomarkers, as well as mental health risk factor biomarkers, not just in the realm of DMT, but also broadly across this sort of evolving world of psychedelic medicine. Because ultimately, we do want to create tools that are not just exclusively for the internal use of Entheon, but we do want to respond to this evolving landscape, this therapeutic landscape that's developing, where there are practitioners that are currently working with ketamine. They will be bringing on new molecules like MDMA and psilocybin and one day DMT. We want to make a series of tools that has, fulfills a duty of care, as I mentioned, to those people that are brave enough to seek out help, seek out therapy. We want to create something that has immediate utility, not just for Entheon's DMT discovery, but for the therapist or practitioner that is on the ground and about to administer something. There's a very important choice, and that choice will become more complex over the course of the next few years as new molecules come online. As someone comes in the office and presents with a series of psychiatric symptoms, the choices will be, hey, is it ketamine? Is it psilocybin? Is it DMT? And depending on how you cut certain issues, some people presume that addiction is underpinned by a PTSD indication. So there are going to be a variety of on-label usages for these medications, as well as a variety of off-label usages. And so we think that there's an opportunity as well as an obligation for a company to come in and to help make that prescribing physician's job that much easier, so that that patient that is maybe for the first time, maybe for a very limited window of willingness, saying, hey, I want to get help, that we make use of that experience and not subject them to many months of failed treatments. And so hopefully that answers your question. The business is thought of almost in two parts that ultimately do integrate: personalization as being this sort of broadly utilitarian thing that we're trying to develop for the industry as it develops. And then that will, of course, sort of dovetail with our DMT-related discoveries specific to addiction.
Yeah, no, that is actually super helpful, because it does feel like a taking on the world.
Yeah, Tim hasn't even explained the other partnership that he has with another Toronto-based company in ECG, brainwave monitoring. So that's like a whole other personalization and trying to understand at a signaling level of the brain, how the brain's activating in real time based on psychedelics. But yeah, I'll let Tim talk about that as well, because that's another area that Entheon's working on.
It's a big meal, certainly, but all things can be eaten one bite at a time. And so, of course, there is a core importance to developing out our, we believe that DMT is the ideal molecule for psychedelic therapy, unlike longer form psychedelics like ayahuasca or psilocybin or LSD, where the time of engagement is anywhere from 6 to 8 to 12 hours, depending on the dose level, and as well as metabolic factors. DMT is actually a very profoundly intense molecule that could be modulated to arrive at a similar effect type or effect intensity as all of those other aforementioned molecules. But it does so in a way that due to the pharmacokinetics of it, the active half-life or the sort of window of experience is anywhere from 15 to 20 minutes. So in these long-form psychedelic experiences, ranging from anywhere from 6 to 12 hours, as we're dealing with inherently profound, sometimes challenging subject matter, whether it pertains to traumas suffered as a child or through our development, this is inherently difficult stuff to deal with. And sometimes it can be overwhelming to the extent that it becomes medically necessary to intervene. Right now, with those longer form psychedelics, there is no meaningful way to intervene to cease that experience. And there is no way to titrate that dose once it's ingested. DMT, on the other hand, once the way that we're delivering it is intravenously. If an individual happens to have one of those intense experiences, we can titrate the dosage, bring the intensity down, or stop it entirely, foregoing the need for heavy sedatives or anxiolytics. So that's one side of things. The DMT is a uniquely modulable, controllable, customizable type of drug delivery. But then on the other side of things, as John mentioned, there's certainly a lot that goes into understanding the personalization characteristics. Genetics is certainly one thing, and we're finding that metabolism is going to be indicative potentially of whether an individual has a too weak response or a too strong response that ultimately could lead to a non-efficacious type of experience. But we're also understanding that each individual, so I think of it as genetics represent what nature has to provide. This is your basic coding. This is the likelihood that your body will present with these types of physiological reactions. There is also a component that I like to characterize as nurture, where over the course of your development into adult life, you do take on specific brain architecture as characterized and as visible through things like electroencephalogram. EEG is a very lightweight, real-time way of measuring brain activity. And we are seeing that there's potential to make assessments as to an individual's cognitive function, their base phenotypes. There are different, just as in the same way there are different personalities, you might have more introverted people, more extroverted people. We do see that there are existing brain phenotypes that are more or less receptive to different types of psychiatric interventions, as well as more or less receptive to different drug interventions. And so, as John was alluding to, it can get quite large, but the tack that we're taking is we're taking indication and molecule-specific approaches to investigating this. We're currently working on some research studies in the world of ketamine, looking at both genetics as well as EEG to better characterize, what is the, divergence or variability in these different patient populations that are going into ketamine therapy, to seeing what the differential response will be from things like ketamine, while being dictated by the metabolic differences that are indicated by some of the biomarkers that we're picking up. So, it is quite a large undertaking, but we are taking it bite size or one project at a time, trying to get a really granular understanding of what how different brains and different genotypes respond to these different drugs, ultimately amassing this massive catalog of knowledge that will hopefully go back into this predictive platform that will ultimately make a physician's job that much easier in terms of assessing and sort of customizing therapeutic designs for individuals.
So at some point in the future, is this this may be totally way off base, but is this something that could potentially become like a 23andMe, but for like psychiatric use or whatever the case may be, where there is some sort of test where it's like, if you've done 23andMe, they tell you like, here's your kidney disease, pyruvate, whatever. Like they give you this list of all these genetic markers, half of which are like, I don't know what that is, but really interesting, right? So is this something that at some point, I'm not saying it would come through 23andMe, but where it is seemingly that simple to take some blood of a patient, send it in, get the genetic markers that the psychiatrist or the treating physician can look at that and go, okay, based on this, here's what could potentially be the best outcome. So it actually does become that personalized. Maythey
You could head there. I think 20,
I like that you're both like, nope, that's not the thing.
23andMe, they have some interesting more, insights like when you eat asparagus, how does your urine smell? Like, what's your coffee sensitivity? That's more out of interest. I already can tell if I'm sensitive to coffee just by drinking coffee, right? But in terms of psychedelics, well, there's no, psychedelics can only be used in the therapeutic setting in clinical trials or medically right now. So I think it's a lot more personalized in the way that algorithm that Tim refers to, which can be brainwave monitoring, which can be genetics, which can be specific molecules, that is not 23andMe. 23andMe is not intended to go to that level of personalization.
For sure.
There's lots of examples in the medical community where they do this all the time. Like, for example, cancer medications now, there's a lot of cancer, there's some specific cancer drugs is you must do a genetic test before they give it to you. Because they know that if you have a certain profile, the drug will just not respond. And so they don't want to give you hundreds of thousands of dollars on medication and get your hopes up on a drug that has a low probability of responding. And so because mental health, it's an art, not a science, because it's the brain. we're pulling in all sorts of data points, whether it's genetics, whether it's brainwave monitoring, whether it's therapeutics. And they're all, as Tim said, it's like picks and shovels for the clinician to actually come up with the right treatment.
Certainly. And data is one thing, but I think there's an importance to how that data is packaged and interpreted. I think, if you were to just look purely at the genetics, it's a very detail-oriented and data-intensive type of analysis. But I think there's an importance to the interpretation, the packaging of that data that ultimately does get to a clinically useful, answering clinically useful question. So, genetics are, we think, a super valuable source of insight, but, we do want to provide the most comprehensive base of information that we can. I have 2 dogs running around.
It's great. Real life.
Real life. I know, pandemic podcasting. No, absolutely. Data is so important. So we're trying to take a multi-tiered approach to data. Genetics certainly tells a very comprehensive story, but we think that could be supplemented by the real life lived reality that is presentable through electroencephalogram. So ultimately, as John mentioned, within the world of oncology, there is already precedent set as to the suitability or appropriateness of certain drug prescriptions. We think that within the world of psychedelics and mental health in general, there is a similar urgency or need for precision because you don't really want to squander that opportunity. Mental health issues can be oppressive to the point that it becomes that the existential conditions of living feel almost as though they're not worth sort of suffering through. And so for that person that is at that decision point of wanting help, understanding that, a day lived in depression or a day lived in addiction is sometimes quite agonizing. Extending the sort of extent of that suffering is something that we try to minimize as much as we can. And we think that taking a very informed, data-focused approach will arrive at, likely efficacious solutions earlier.
Fantastic. Where can our listeners go to find out more about what you are up to in the world and about you as well as humans?
Yeah, please. I encourage anyone that is interested in what we're doing to visit us at entheonbiomedical.com, also HaluGen.com, and encourage everyone to, as is typical these days, sign up to our socials. We have so many really interesting and we think very noteworthy and scientifically relevant things in the works. We encourage everyone to sign up for our newsletter to be really in the stream of that information as we develop it. We are working on some amazing things and trying to help a lot of people. So we encourage everyone to sign up and get in the stream of that.
Absolutely. So I want to thank you both for taking the time to chat with me today. It's really interesting. I think this is a really valuable conversation and information for people to get about what's happening in this world of psychedelics, of these sorts of alternative, let's call them, but alternative from what we tend to think of mainstream treatments, because it's the future of medicine and it's the future of biotechnology, genetic, like there's so much happening here and it's really cool. So thank you both for taking the time to chat with me. I appreciate it. And absolutely. And for all of the listeners and viewers, thank you for listening to Canada's podcast. Like, comment, and subscribe to all our channels to get the latest podcasts from entrepreneurs across Canada.